I am Dr. Katie Schmitt. I am the physical therapist here at Hollings Cancer Center. I'm here today with Kenny. We are here to show you a full body stretching exercise. With cancer treatment, especially if you've gone through a transplant, you may be suffering from graft-versus-host disease, some tightness, or just general tightness and weakness from all the treatment. So Kenny and I work on a lot of great stretching, and we're going to show you the whole program. But first,
and one of the things that's real important, she gives these great handouts, but it's important to cover them and get them laminated, and that way you can find them because it doesn't look like all the rest of the pieces of paper around the house.
Exactly. So now you can easily find your homework and do them all the time, which I like. All right, so the first stretch we're gonna do is for your neck. We're gonna do the upper trap stretch. You can come over to the side. And we're just hanging out here for about 30 seconds. If you're very, very tight, you wanna essentially hold the stretch until the stretch goes away. So it might be 30 seconds, might be a minute, might be 3 minutes. So use this as an opportunity to just kind of breathe through things and really let your body open up. Slowly, come on up, go to the other side. How's that feel?
Great.
Good. You want to make sure with all your stretches you're not going into any pain. So if you have a loved one watching you and you start wincing in your eyes, that's a tell that it's too much and you want to back out a little bit. Nice and slow. Come on up and out of that. Give me some shoulder rolls. Just kind of opening that up. And go back the other way. Perfect. You're gonna take your arm out, fingers up, get your thumb involved if you can. We're going through a nice wrist stretch. The more you can keep your elbows straight, the more you can get this stretch. And as you breathe into it, your body might let you go a little bit deeper. Good. Nice deep breaths out. Now you're gonna flip. So you can do these stretches in any order that you want. I'm partial to going like this and then like this. So that's why I changed Kenny's hand. Some people like to go like this and then do the other hand. It's fine either way. It doesn't really matter as long as you're spending time stretching. That's what's important. Go ahead and do the other hand. Perfect. Nice little shake there. You can see the muscles are working for it. Relax your shoulders, they can't help you. Good. We're gonna hold here for a few more moments and then take it and switch it. Good. During a wrist stretch, especially if you have any neuropathy in your fingers, it's a great time to really look at the fingers, play with them, kind of touch them a little bit, give them some sensation, and that'll help with some of that numbness and tingling that you might be having. All right, we're gonna shake that out. We're gonna go into the cat-cows. So I'm gonna move my table up a little bit so you can put your feet on the floor. Sitting up nice and tall. That's arching your spine. And then curve everything in. Yeah. Nice arch. We're gonna do 10 and curve. Good. And arch, really think about like a string coming out of your chest. And curve right over everything. Open up your thoracic spine. And arch. And curve. One of the reasons I wanted to have Kenny as my model today is you can see he does everything with his breath. So you don't want to hold your breath. You want to let your breath control the movement. You want to let your breath move and guide you through it. Good. Give me 2 more. Nice and open. And curve and really feel it all the way to your lower back. And relax. Good. All right, now we're gonna rotate. So you're gonna take your right hand, you're gonna put it on your left knee, take your arm, twist yourself that way. You can hold on to the back of the table. If you're in a chair, you can hold on to a chair. Kind of lift yourself up a little bit, good. And breathe. Yeah. Any pain?
Go.
Good.
Bottom half of me hurts.
Hips. Is that my fault for making you work the other day? Good. Nice and slow, come on out of that. Twist, go the other way. Nice deep breath in, lift yourself up, and relax. Good. If anything hurts with a stretch, just sneak yourself out of it just a little bit. You don't want anything to be too painful because then your muscles are gonna guard, they're gonna hold, they're not gonna let you go. You want everything to be nice and loose, nice and relaxed. One more breath in and out. Good. All right, now we're gonna switch to our lying down stretches. So give us just a moment to get situated. All right, so now we are laying down. You can do this in the middle of your bed, somewhere you're not gonna fall off, or on the floor, or even probably on your couch. We're gonna do a hamstring stretch. The looser you can get your hamstrings, the less back pain you're gonna have. So I like you to have that leg bent. We have the band around this leg. Bring it up, straighten your knee, hold. This one is super important and I can see the clock from where I'm standing. So we're gonna be sure to hold this one for a full minute. The hamstrings pull on your hips, that pulls on your lower back, especially if you've been sitting for infusion or if you've been going to doctor's appointments and sitting and waiting, your back might be really sore. This is gonna be fantastic for that. Breathe on into it, keeping your other leg bent so that your back is flat. Try and straighten your knee. Yeah. We're halfway there. A minute is a really long time when you time it. Any pain? Good.
Just weird on my leg.
I'm not being that mean, right? I hope not.
Yeah.
It should feel stretchy. If you feel nothing, then that's wrong. But it should feel nice and stretchy.
Feel stretched.
Good. Now we're gonna go into an IT band stretch. So you're gonna take your leg, you're gonna drop it this way. Keep your leg nice and straight. Feel the stretch? Perfect. We're gonna hold this one. The IT band runs along the outside of the leg and it can really make the knee very irritated, especially if your hips are weaker and you're walking and your knees are coming in a little bit, or if you're a runner or if you're a cyclist. It's really important to get this to be nice and stretched out. Kenny's been practicing this, so he doesn't look like he's in extreme pain, which is great. But sometimes when we do this in the clinic and we go into this position for the first time, patients are like, and that's how you know they found the stretch. So if you're squinting right now, back out of it a little bit. We have about 5 more seconds right here. And then we'll switch and we'll do the other side. All right, bring your leg up and relax it down. You can let it go. Yep.
I want to go outside.
Nah, you can do an adductor stretch where you bring your leg out to the outside, but I figured we'll get that a little bit with the piriformis. Bring your leg up, bend this knee. Perfect. 1 minute right here. Trying to get it nice and straight.
Something else I do with my rubber band is I put a knot in it and that it didn't slide out of your hand.
That's a great idea. You can use a belt too, like you can knot the belt, put it around here and just let your hands sit on it, especially if gripping is not very easy for you right now. You're halfway there. As you breathe into this, the stretch might let you open up a little bit more. It might let you get a little straighter. There's days where you're gonna be more tight and days where you're gonna be more loose. Just give yourself the grace to let it be open. 10 seconds. Good. Now you're gonna take your leg, you're gonna drop it towards me. Feel the stretch? Perfect. With the IT band stretch, if you take your foot and you bring it down towards me, how's that?
Different.
Okay. Different more, different less?
Is that okay? But it just feels different.
Okay. All the stretches, you want to play with them. Your muscles attach to certain points, but everyone's body is going to be a little bit different. So where Kenny feels the stretch might be different from where I feel the stretch, might be different from where you're feeling the stretch right now. So you can kind of tweak your feet, tweak your leg, get the stretch in a slightly different spot. Looks great. About 10 more seconds. And these are things that you want to do every day. If you can pair them with stretch after lunch, stretch after dinner, makes it easier to remember. All right, we'll relax this down.
This thing I miss when I'm doing this, my dog's not right here.
We'll have him in the next video. This one. So bring your, bend your knee, bring your ankle across your knee. Perfect. This is your piriformis stretch. It's the little muscle at the back of the hip that runs over the sciatic nerve, especially if you're having pain that's shooting down your leg from sitting for a long time. This one's going to be really helpful. When you're in this position, you can either press the leg down or you can pull it to your opposite shoulder, and that's how you can kind of play with the stretch a little bit. How's it feel?
Just fine.
Stretching is not usually anyone's favorite thing to do, but I'm really happy that you turned on this video because we should all be stretching a lot more every day.
Because after I stretch in the morning, I feel a lot better.
Yes, I like that. Switch, other side. I'm gonna do it with you because why not? Good. Stretching is one of those things too. It's a good time to kind of just give your body over to it and be in the practice of letting go for a moment and not thinking about everything else that has to happen throughout the day. Let other thoughts go and just listen to your body and feel the stretch and feel it open up. Five more seconds and you're going to come out of that. Good. Come on out of that. Last stretch is for your quads. This is one that you can do in standing, but I like it better in sitting. Roll over onto your side. Either one, we're going to do both. So, we're essentially stretching the front of the thigh here. The band is around the ankle because it's not always easy to do that, and pull your leg up towards you. And you want to just focus on bringing the knee back as much as you can and letting the front of the hips open up. Making sure you're breathing. This would probably be a good one too, to have your band with the knot in it so you don't have to pull on it so hard. I'm just going to give you a little bit of an overstretch. Is that okay?
Mm-hmm.
And you want to make sure with the quad stretch that you're not letting yourself fall backwards. You have a nice forward posture and everything's kind of in one line. And if it causes any knee pain, stop. Okay, you can let that go. Flip on over other side. When you flip over at home, does the dog run over to the other side?
No, she just stands up and catch usually on the side. Good group exercise.
I love it. Come this way. Perfect. 30 seconds right here. As you breathe into your stretch, do you feel like your body opens up a little bit?
Oh, of course.
Love it. One of the other good things too about Kenny's idea for laminated sheets of stretches is you can put stretches in your bedroom, stretches on the kitchen, on the refrigerator, and then when you see them, something that is a little bit of a mind trigger, and then you can do them when you're there. You don't have to do all of this stuff all at once. You can break it up throughout the day. Slowly come on out of that. Roll onto your back. Good. Come on up. Good. How do you feel?
Great.
Fabulous.
Stretched.
There we go. Again, as in all the videos, this is not in place of medical care. So before you take on any stretching program, please talk to your oncologist or your doctor, and we'll see you next time.